Providence St. Vincent's newest employee is making history. Wrangler is the hospital's first full-time facility dog, and he's just for kids. But he's hanging out with the adults tonight. Wrangler's here along with Teddy Garland, a child life specialist, and also nurse Leslie Zimkis. So let's start with Wrangler and what Wrangler's all about. Teddy, do you want to start us off?
Yeah, so Wrangler is our hospital facility dog. He was trained professionally by Assistance Dogs of Hawaii. He knows over 90 commands that are specific to the hospital setting.
Really?
Yeah.
Like what would be different than you would hear at home?
Snuggle would be one of them, where he's trained to lie his head on the shoulder of a patient. Visit is another one where he rests his head on the edge of a bed or a chair of a patient he wants to get closer to.
You know, I was surprised at how young he is.
Yeah.
He's, 20 months?
20 months, yeah.
I would have thought the training alone would have taken that long.
He started training when he was 7 weeks old and graduated from Assistance Dogs of Hawaii at 17 months old.
And I understand he has an impressive lineage.
He does. He is from 50 generations of guide and service dogs.
Wow, 50 generations.
Yeah.
All right, Leslie, let's talk a little bit about what Wrangler does and how it fits in with what the hospital's doing.
Yeah, at Providence, the Children's Health Program has just expanded over the last few years. And we have our child life specialist all throughout the children's areas and also helping in adult areas at Providence St. Vincent. And so with Teddy, she is exclusively in the children's emergency room, which is now exclusively for kids 24/7. 7 days a week, and Wrangler is part of Teddy's kind of toolkit, if you will, to help our kids when they come into the hospital to make the experience just a little bit easier for them.
So tell us a little bit more about a child life specialist and what that means.
So in simplest terms, my job is to help kids cope with being in the hospital, whether that be preparing them for an IV procedure or stitches, helping them make a choice about what they want for distraction during those procedures, preparing them for hospital admission, surgery, anything like that. So it's our job to explain things in a developmentally appropriate way, as well as support patients during those procedures, so involving parents and using distraction and different techniques. How
do you decide which patients should get to see Wrangler, Leslie?
Well, I think it's just depending on what they've come in for. Usually at the emergency room visit is their first experience of the hospital, and so we really, our nurses and physicians rely on Teddy's assessment of those patients to see how her services or Wrangler services would best be used.
And I can imagine the response you see instantaneously, because for kids it's scary to go into the hospital first of all, but second of all they're dealing with an injury that's brought them there. And then to see Wrangler, what happens?
It's almost immediate, like you said. I walk into a room with Wrangler, introduce myself and my role and Wrangler as part of what I do, and kids immediately focus on him. He's the easiest transition into building rapport with kids. When he hops up in the bed and kids pet him, they almost forget that they're in the emergency department.
Just incredible.
Yeah.
All right, so let's see some of what Wrangler can do. He's so well behaved. Can you bring him to my house and try to teach ours?
Yeah, I would
manners?
love it if it was that easy. Nice watching. Wrangler, can you touch? Good job. Touch. This way. Good boy. Sit. Thank you. Nice watching. Down. Good boy, Wrangler. Would you like to try?
Sure.
Wrangler, are you ready?
Come here, Wrangler.
Touch.
Touch.
Good boy.
Now he's like, okay, where's my treat?
I know. Exactly. Here, we have one for you.
There you go. So I would imagine, Leslie, you're probably at a point where, well, first of all, why did you decide to do this and how hard was it to implement?
You know, we decided just, again, with the child life specialist, you know, Teddy really had this vision of the facility dog at St. Vincent's. We do have pet therapy dogs, but with Wrangler being the facility dog, he is especially trained to, again, assist in procedures and stuff that are appropriate for him. So it was really her vision coming to light. So working with Assistance Dogs of Hawaii and working with our leadership at Providence, everybody was just so excited to have this implemented for our kids.
I would imagine you probably will get to a point, if you haven't already, where you wish you had a couple Wranglers, maybe more.
I'm asked every day.
Really?
What's unique about him, though, is he's our the first facility dog exclusively dedicated to a children's emergency department in the world that we know of. So he's starting a new thing.
Well, we're grateful to have Wrangler doing his job. Wrangler, you're a good boy.
Say thank you.
He knows where the treats come from.
I know.
Black pants, probably not a good call tonight.
No, for all of us.
Yes.
Teddy, Leslie, thank you very much for joining us tonight.
Thank
Wrangler,
you
thank you
for having
too.
us.